Dr. John Torres here on this Daily Doctor, where twice a week I cover topics about the pandemic, particularly go over issues that affect you, your family, your loved ones, your community, and things that can hopefully help get you through this pandemic healthier and in a quicker fashion. But today, a little bit something special. I'm at National Jewish Health in Denver, where I'm getting my second COVID vaccine. I got my first one, the Pfizer vaccine, 3 weeks ago, and I did a Facebook Live just to get you up to date a little bit. The next day, had a little bit of arm soreness, was feeling a little bit fatigued, but beyond that, after 2 days, it went completely away, felt completely normal. And we do know after the first shot, you get a little bit of protection. We're just not sure how long that protection lasts. That's why you need the second dose of this. After the second dose, I have the Pfizer vaccine, 95% effective at preventing COVID. Moderna, 94.1% effective at preventing COVID. Those are the two shots we have right now. But I'm getting my second shot. And with me, Emily Cole, right? All right, how are you doing today?
Good, how about you? You ready?
I am ready.
Let's do this.
Left arm work for you?
Yep, make sure this is you and your date of birth.
That is me. That is my date of birth.
Left arm.
All right.
All right, here
You guys are pretty busy today.
We are. We're vaccinating.
This is my card.
Several hundred.
For those who haven't seen the cards yet, these are the CDC cards you get out there. And it basically has the type of vaccine you got, Pfizer, 2 doses with the lot numbers in case that's needed later on, and the fact that I got the shot. So here we go.
All right, here we go.
All right. I'm not a huge fan of needles, I'll tell you right up front. But last time I got it, didn't even really feel it. And hopefully this time, it'll be about the same. And again, last time, next day, a little bit of arm soreness, that's pretty typical. All right, and a little bit of fatigue. That was all I really had. So this one, again, you can feel it a little bit. Stings a little bit, but other than that, no real issues with it. Emily, fantastic.
Thank you.
Thank you.
Thanks for getting vaccinated.
Oh, yeah.
All right, no blood, you're good to go.
All righty. Excellent. Now what I want to do is I want to talk about the vaccine and some issues around the vaccine. And joining me from National Jewish Health is Dr. Jay Finigan. Thank you very much for being here with us.
Thank you.
So you're a pulmonologist here at National Jewish Health, which is essentially, this is the pulmonology specialty center of the country.
Yes.
This is one of the big kahunas here. So you guys have handled a lot of COVID recently. I want to particularly focus on the vaccine. I just got my second dose. We always hear that after the second dose, those symptoms are a little bit stronger. Like I mentioned last time, I had a little bit of fatigue, a little bit of arm soreness. I'm going to be expecting more symptoms this time.
So some people have no symptoms. A lot of people have arm soreness. That's very common. That's a sign that the vaccine is working, right? You're getting immune cells in there, recognizing what it's seeing, and it's doing what it's supposed to do. Many people have no symptoms beyond that. Some people do have some symptoms that can range from fatigue, low-grade fever, meaning like 99, maybe 100. You might even feel a little sort of flu or viral-like illness. Very reasonable to take Tylenol, aspirin, Advil, one of those kinds of medicines. You might have that for about 24, maybe 48 hours, and then that's about it.
Now, one of the big questions I get oftentimes is about taking that Tylenol, that ibuprofen, the acetaminophen, which is what's in Tylenol, prophylactically, prior to getting the vaccine to try and help out. But some experts are saying you don't really want to do that before you get the vaccine.
There's really no evidence that doing that is going to change the effectiveness of the vaccine. So if it's going to make you comfortable, if it's going to make you feel fine, that's fine to do. It's not going to change the impact of your immune response.
And I talked about the effectiveness of these vaccines, especially after the first dose and then after the second dose. How important is it for people to get that second dose if they're scheduled for a second dose?
It's critically important. So certainly there's going to be some immune response to the first dose. What we don't know is really how robust that's going to be and how durable that's going to be over time. The studies have been with 2 doses, so really we have to follow that 2-dose strategy right now. And the evidence suggests that these are incredibly effective vaccines after that second dose.
Yeah, 94.1 for Moderna, 95 for Pfizer. I'm going to be moving my arm a little bit here.
Go ahead.
Just to keep it.
Go ahead.
I don't want, and what do you tell people as far as things to do? Moving arm is one of them.
Yep.
Keep moving your arm. And some people get in their dominant arm. I prefer my other one. I always prefer my left arm. What else do you tell them to do?
I tell people sort of what I've told you. I tell them that, you're probably going to have some arm soreness. I generally tell people that if you have an arm that you prefer, you can always go to the other arm for the shot. Doesn't really matter that much. As I said, you might have some symptoms. I recommend that people don't plan anything really major the day after their shot, right? So if there's something that's really critical that is important for you, maybe don't have that planned for the day after your shot. As I said, if you need to take some Tylenol, some ibuprofen, acetaminophen, go ahead.
And you mentioned how important getting that second shot is. We've heard across the country that there are some people that are not returning for their second shot for a variety of reasons. Are you seeing that here?
Not really. We are seeing a lot of people come back for that second shot. So
I know, snowstorm notwithstanding, we had one last week, and that probably slowed things down a little bit.
Yep, but in general, everybody who comes in for their first shot is getting their second shot. We see occasionally people who don't show up for their first shot. I think that's normal. There are people out there who are getting on multiple lists. They're just doing what they can to get the vaccine. That's certainly reasonable. What I would say to anybody who gets on more than one list is if you get an appointment for a vaccine that you know you're not going to use, cancel it. That just allows us to schedule somebody else to get that person the vaccine.
And it's important to get all those vaccines used. What I typically say is, if it's in a freezer or refrigerator, it's not doing anybody any good. It's got to be in an arm.
Yeah, correct. So when we get the vaccine, we, as quickly as we possibly can, get it out to people. Once we get that vaccine ready and drawn up, we have about 5 hours before we have to get rid of it. And so we are going to give that vaccine. We're going to find somebody.
Now, I was here 3 weeks ago, and you guys had just initiated giving mass vaccinations, had people come in. That first day, people had to wait, not long. I think they were waiting 30 minutes to an hour time frame. But at the same time, it's longer than people wanted to wait. Coming today, it's a different story.
Yep.
You guys have a really good system set up here. You have it by appointment. People are coming in. How hard was it to get to that, to figure out how to iron out those wrinkles?
So it really took us one event to realize that we needed to make some changes. As you indicated, that first event went well, but clearly some things that we wanted to do better. Mass vaccination is a relatively new thing for all of us, right? But we recognize that being able to do lots of people in an efficient way was critical to this response. And by lots of people, I mean upwards of a few thousand a day, 2,000 or more a day. We very quickly moved this out to our parking garage where we could do drive-through vaccination. We are now looking to work with some community partners around other mechanisms giving the vaccine so that we can do it both outdoors as well as indoors to do large mass events to get people the vaccine. It goes very smoothly. In general, people show up, we make sure that they're in our system. That takes a few minutes. You get the vaccine, you have to wait for 15 minutes to get watched, and that's it. The whole experience takes no more than 30 minutes.
And I think I heard in the midst of me getting ready for my vaccine and getting ready for Facebook Live that you were last week were giving shots at a Catholic church here in town.
Yep, so we partnered with the state and the governor and a local Catholic church and some state representatives to try to target that community, so the community that is in that neighborhood and uses that Catholic church. This is a largely Hispanic community, and we're really trying to work with the public health forces around the state to try to target equity. That's one of our focuses at National Jewish, and so that was important for us to get out to that community.
And personally, thank you for doing that, because this is one of the neighborhoods I come from in New Mexico where everything centers around the church. And so what I always talk about is up until now, we've essentially used the plan or the thought of getting people to go to the vaccines, and what we're moving towards is now getting the vaccines to go to where the people are, which is what you did last week.
Yeah, I think we're gonna have to do multiple different ways to get the vaccine out. Certainly being able to do mass events at a place like National Jewish or something similar is going to be important. The ability to go out to communities to get the vaccine to them. There's a lot of different things we're going to have to do over the next several months. We are willing to be as flexible as we need to be. Whatever it takes to get vaccine out, we'll do.
And we know other family members that have gotten the vaccine as well. Both couples have gotten the vaccine. We both got our vaccine. What can we do now? Can we change anything we do now that we're all we're vaccinated? And once, of course, we get to that 2-week time period where we get the full effect of the vaccine.
Yeah, so I would say, in general, number one, you should just feel good that you got your vaccine. You've done your part. You're helping out. You have dramatically decreased the chance that you're going to get the infection. And I think likely the chance that you're going to be able to pass that on. We're still waiting on some data on that. But I think in general, the chance that you're going to be able to pass this on is going to go down significantly. In general, we don't want people to change their social distancing habits right now. So social distance, wear a mask, those kinds of things. What I do think is reasonable, though, there are things that you have not been doing because of the pandemic, going on a plane, those kinds of things. I think that's reasonable to start considering now. So,
assuming you mask up, you social distance,
exactly. And that is really largely to prevent the chance that you could harbor the virus and spread it to somebody else. Again, there is a small chance that you could get an infection. That's true of really any vaccine. But I think over time, as more and more people get vaccinated, the rates are going to continue to go down, and we're going to be able to loosen things up as a country.
Are you optimistic that we'll get to that herd immunity fairly soon, or do you think it's going to take?
I am optimistic. I think that part of the reason we're seeing rates go down now is partly because of vaccination. I think as more and more people get vaccinated, it's the equivalent of de-densifying the population. You're essentially taking people out of the population who are going to get sick. It also has the effect of not letting this virus propagate and develop new variants. So I think all in all, this is going to have a huge impact on the virus and the pandemic.
And for people watching the Facebook Live, just the last question, I always try to get my experts to answer this one question to give people some hope. What's your bottom line? What's your message to people watching this?
My message is that this is going to come to an end. This pandemic is going to come to an end. We are on the road right now to that. So again, the fact that we are now vaccinating people, decreasing the number of people we're having to test, decreasing the number of people we're taking care of in the ICU, while at the same time dramatically increasing the number of people we're vaccinating. This is clearly the road to this pandemic being over. People just need to be a little patient. It's going to happen. I think it's going to happen this year. We just need to get there.
And Dr. Jay Finigan, again here at National Jewish Health, I can't thank you, the establishment, William Alstetter, who's the PR person here that's been working with me to get all these Facebook Lives done. Can't thank you guys enough for one, giving people an idea of what goes through here when you're getting a shot, what you have to go through, and what it's like. It's basically almost a non-issue. It's a shot like you normally get flu shots, not a big deal. But more importantly, taking care of the community and taking care of people around here and helping us get through this pandemic.
Well, you're welcome, and thank you for getting vaccinated.
Thank you. And thank you guys very much. And again, we're at the beginning of the week. At the end of the week, we'll do more updates. I'll give you an update on what I felt like tomorrow and talk to you and get your questions at the end of the week. But otherwise, have a great week. And like I always say, try to stay as healthy and as happy as you can.
Are you a fan of our videos? Be sure to subscribe to Worldwide Campus News and Entertainment. Then ring the bell to see all notifications about the new videos and the latest video.